In this presentation, the implementation of novel technologies for teaching and learning normal and pathological anatomy of the spine will be discussed. These technologies range from medical imaging to 3D printing. 3D printing has been revolutionizing medical education, especially over the last decade, and has the potential to provide medical students with an invaluable resource to observe the progression of the human body from its normal anatomy to that associated with pathology. Specifically in this project, we would like to shed light on the suitability of this technology to outline the pathophysiology of degenerative spine conditions. Medical students study the key characteristics of pathologies of the vertebral column, for instance, osteoarthritis, including the development of enthesophytes, osteophytic lipping, narrowing of the joint space, subchondral sclerosis, cyst formation, etc. However, they rarely obtain the opportunity to visualize this process using clinical data from real-life patients to form 3D models of pathological anatomy. In terms of imaging, medical students tend to have access to radiographs of osteoarthritic joints and little else, particularly in early years. For those starting to become familiar with the field of radiology and who find the interpretation of X-ray images challenging, a 3D model could aid in their understanding of musculoskeletal conditions. Students will be able to visualize pathologies relating to the spine during surgery later in their medical education, but this technology could enable students in preclinical years to gain a more comprehensive understanding of the degeneration of the vertebral column. This could prompt further discussion regarding related symptoms, including nociceptive or neuropathic pain, while demonstrating the clinical benefit derived from procedures such as laminectomies to relieve compression. Traditionally, cadaveric dissection has been the gold standard for teaching anatomy, but this has been criticized in recent years due to the recurrent idea that it can often be disorganized, not individualized, as there are many students working on the same cadaver, and delicate structures are susceptible to damage. Its value is often lost, and educators have begun to seek additional resources to complement this experience, especially in light of the COVID-19 pandemic, which has rendered in-person teaching practically impossible in many universities around the world. The main disadvantage of this technology is its cost, given that it would require significant investment from universities. The benefits of utilizing 3D printing technology within the context of medical education can be maximized by synergistically combining them with a wide variety of resources already in use in universities in the UK and in Spain. This includes online 3D anatomy platforms such as anatomy.tv, cadaveric dissection, and labeled 2D diagrams and medical imaging in textbooks. One of the most complex anatomical regions for medical students is the spine, both in normal and pathological conditions. Therefore, when it comes to learning anatomy, medical students would benefit from the observation of the progression of degenerative pathologies of the spine. This would also allow insight into clinical anatomy, given that data used to build 3D models are obtained from real-life patients. 3D printing technology harbors great potential if incorporated into medical education, as it enables students to consolidate basic anatomical knowledge relating to the spine. Moreover, 3D models could help students differentiate between similar conditions, given that enthesophytes, osteophytes, and ankylosing spondylitis can appear similar on radiographs, so a 3D model can highlight key features used for their identification. Within the framework of the Teaching Innovation Project, design and 3D printing of anatomical models using radiological imaging techniques and artificial intelligence for medical education, led by our research team at the University of Granada, we have specifically addressed this problem in the medical degree. To do so, we have implemented an innovative teaching system using examination of medical imaging and 3D printed models. The aim of this work is to present our teaching methodology and the results of an initial experience of implementing new ways to learn anatomy through medical imaging and 3D printing in a selected cohort of undergraduate medical students. The following methodology was utilized to assess the impact of novel teaching methods compared to traditional teaching on the consolidation of anatomical information in undergraduate medical students. The experimental group experienced the 3 levels of learning, both for the normal and pathological spine. Ideal anatomical models of the spine using traditional 2D diagrams and interactive 3D models. Examination of medical imaging, including computed tomography and magnetic resonance imaging, and 3D printed models. Students were offered each of these different models to learn basic concepts involving the normal and pathological spine. After the learning period, students were examined using a short multiple-choice test. The rate of correct answers was compared with that of another group of medical students matched by academic year and sex, who had been subject to conventional learning on spine anatomy using the Fisher's exact test. Data were analysed using SPSS version 23.0. A short ad hoc questionnaire was provided to the experimental group to assess the overall satisfaction with each method, and open questions on the advantages and limitations of the learning methodology were recorded. In this case control study, 20 undergraduate medical students were allocated to each group, and each of them answered a total of 20 multiple-choice questions. This is an example of the type of multiple-choice question the participants had to answer during the test. Each question had a total of 4 options to choose from. The results showed that the experimental group had a higher rate of correct answers at 80% compared to an average of 55% in the control group, although this difference was not statistically significant at p equal to 0.176. The ad hoc questionnaire given to the experimental group revealed a high rate of satisfaction regarding the use of medical imaging and 3D printed models, as they helped depict examples of specific pathologies including osteoarthritis. However, limitations included the relatively low representativeness of 3D models to depict intervertebral disc herniation, and poor knowledge of medical imaging interpretation, which may have hindered the full potential of these novel teaching methods. It's possible that understanding basic concepts in the examination of medical imaging could boost learning in medical students significantly. The COVID-19 pandemic has changed medical education radically due to the sudden and complete shift to online teaching. While trying to compensate for the lack of normal in-person teaching, including cadaveric dissection, professors have assembled a wide range of resources which have the potential to improve medical education in the long run, and which will be maintained so students can access them. This could mean that teaching will not return to what was defined as normal before the pandemic. This innovative methodology, which has not been used previously in our country to our knowledge, shows promising initial results and offers a new way of understanding human anatomy. Overall, our teaching project sheds light on the suitability of advanced medical imaging and 3D printing to outline the pathophysiology of degenerative spine conditions. This presentation lies within the framework of the Teaching Innovation Project, Design and